Welcome to Hacettepe and this is the second case of the month series. Let's start with the case.
This is a very fast-growing tumor occurring in a 10-year-old boy. It's paratesticular, like inguinal area, and it has a history of 2 months. And when we look at the case, it's somewhat cellular with microcystic areas like that, and we can appreciate the chondromyxoid or a matrix-like material here, but it for the surgical pathologist, it quite represents the yolk sac tumor pattern, as we have these vascular structures and here Schiller double-like bodies, and the cellular features are somewhat bland, and we don't have prominent nucleoli or a great any great pleomorphism. We also have some areas, more solid areas like that, and this tumor, we have these small cell-like areas also, but in the yolk sac tumors we can see such kind of morphologic variability, and we ordered some stains. Okay, this is SAL4, a pan-germ cell marker, and it's let me go other areas here. The SAL4 is nuclear positive and has glypican 3, as you see here. This is a glypican 3, and lastly we have AFP. Let me find, it's hard to find sometimes because it's very focal. It may be focal. You never find diffuse AFP in yolk sac tumor. Okay, this is a good one here. So we have this small positive areas with AFP. So we diagnose this as a yolk sac consistent with yolk sac tumor. Please check out the testis, and after two weeks we receive the excisional biopsy, and they work up the patient with this inguinal mass here, and there is no relation to testis, no related testicular tumor, and AFP levels were normal. And they took out the whole tumor. As you see here, it's vaguely nodular, and it's like glistening, and it's cream colored and vaguely nodular. We can appreciate the multinodularity as we see here. There's a nodule here, another one is here, and it's like multinodular. It has also these solid areas with the microcystic areas, and the areas with the more abundant matrix, and it's infiltrating the surrounding fibrofatty tissue. And these are the areas that we encountered in the first incisional biopsy, and these areas are with the matrix, more abundant matrix, and these areas resembles more like the trabecular areas with, again, with matrix. And these areas resemble actually extraskeletal myxoid chondrosarcoma. And also we have these solid areas, and if you come closer to the solid areas, the cellularity is increased. Here we have mitotic figures, and some cells have prominent nucleoli, and these cells looks like epithelioid. And in other areas we have again areas with like Schiller dual like bodies, and these areas resemble the yolk sac tumor. We performed the same markers again, and they were also positive. This tumor is positive for SAL4, this is positive for glypican-3, and even AFP. But here comes the marker that totally changes the diagnosis, and this is INI1, smudge B1. So here, as we see, the tumor cells are completely negative, and the cells staining with INI1 are just the accompanying normal cells like endothelium or stroma or lymphocytes. And here these areas resembling yolk sac tumor are negative. They lost INI1, and both that yolk sac tumor like areas and solid areas, they all lost INI1 here. Then after we have other stains like this is EMA, and this is some areas are positive for EMA, and but for the diagnosis of myoepithelial carcinoma S100, this is S100 staining, the fat adipocytes and the other cells are negative, and this is against myoepithelial carcinoma. And again, SMA is also negative, so we cannot give diagnosis. And brachyury is for the parachordoma. This is also negative, so this tumor is diagnosed as SMART-B1 deficient sarcoma or neoplasm. So just to give a brief summary for INI1, this gene is located in the 22nd chromosome, in the long arm of that chromosome, and it's the core component of BAF complex. And for the ones that are interested in these are the abbreviations of those names. And this INI1 is a small protein of a very large complex, that BAF complex, that modulates the gene expression by remodeling of chromatin. It has impact on different pathways like BNT, sonic hedgehog, polycomb, and cell cycle, and it has some functions on the cell proliferation and differentiation, and even inhibition of tumor formation. And there are the list of the tumors that show INI1 losses. The ones that are complete loss with the atypical pterygoid tumor and its related tumors, they are the first ones that has been shown to express the INI1 loss, and the renal rhabdoid tumor and the medullary carcinoma of kidney, and the carcinoma lists are growing. The pancreas has been shown to lose, and some undifferentiated endometrioid carcinomas has been shown to show the INI1 loss. And from the list of epithelioid sarcoma, from the point of view of sarcoma, epithelioid sarcomas, extrarenal malignant rhabdoid tumors, and 50% of the MPN epithelioid MPS NSTs and myoepithelial carcinomas, some cases of extraskeletal myxoid chondrosarcomas, and this poorly differentiated chordoma is the new kid on the block, and the extraskeletal myxoid chondrosarcoma, which is in the differential diagnosis of our case. And also we have some cases showing a partial loss like synovial sarcoma, ossifying fibromyxoid tumor, and schwannomatosis. So this is a very related paper to our case, and they show the Fulp and his friends show the in that area, the vulva or inguinal area, let's say, because of the similarity of the area. The most common tumor is the proximal variant of with a 50, near 50%, and we see this definition, INI1 deficient, sarcoma definition coming from this article, because some cases, although they show INI1 deficiency, they lack S100 or SMA expression, or they don't like any other tumors like a myoepithelioma or the two variants of my epithelial sarcoma, so they are like unclassified. So therefore we choose to diagnose like this. And the other interesting article on this, Zameknik and his friends showed sinonasal INI1 deficient carcinoma with a yolk sac differentiation, just similar to our case. And here the yolk sac like component is negative for INI1, and they also worked on yolk sac tumors, and they've shown that the yolk sac tumors, gonadal yolk sac tumors, do not they are not INI1 deficient, but they are not sure for the extragonadal germ cell tumors. So that's it. Thank you for listening to us, and hope to see you in other cases next month. Thank you.